hear what CIPHER is doing, and to hear from the students and the collaborators and community partners and about what you're doing. So I'll just say I'm Kathy Sikkema, I'm chair of the SMS department. I'm thrilled to be able to introduce I'm not even sure what to call you, the CIPHER crowd. That you probably have all kinds of names you refer yourself by. My understanding is that there are 4 students and Coach Dave and some facilitation by Dr. Bob and Hopper. But let me just see if maybe hands up of the students as I say your names. Peter Scheer is up there providing the Christmas holiday music. Where's Kaylee on mine? There's Kaylee Barrett. Everybody has a different screen, so it's hard to see where people are. Lena Kerbeck, did I say your last name correctly? Hello, Lena. And let me think. Tiaja, there you are. You moved around the screen. Tiaja Hunter. So Coach Dave, again, thank you for joining us. And of course, to Bob Fullilove and Kim Hopper for all the outstanding, hopefully the students will want to acknowledge you, but let me do that as well. For your commitment and support and advice on this fantastic project. So, I will let you take it from there. And I think we'll have a presentation, discussion, and facilitation after. And just very excited for this to be such an exemplary effort by our students and a collective one at that. So, thanks everyone.
And I think that goes to me, right, to do the introduction.
So I'll just really quick, thanks for we were gonna introduce ourselves really quickly, a little roll call, and then we're gonna launch into a short video, and then I got some words from our amazing faculty sponsors, Dr. Bob and Hopper. First, we'd love for people to use the chat as much as possible. If any questions come up through the presentation at all, don't hesitate to drop a line in the chat. We have some of our other leadership we'll be monitoring what's coming through, answering questions as they come in, and then compiling those that we can answer later on in kind of a student panel session at the end. So I'll launch us. I'll just introduce myself really quickly. My name is Kaylee Barrett. My pronouns are she, her. I'm in the SMS department as a second year, and over the summer, I helped project manage the CIPHER effort. And then to Asia, if you wanted to go next.
Hi everyone, I'm Tiaja Hunter. I'm a second year SMS student, and over the summer and still currently, I'm serving as CIPHER's Community Needs Assessment and Outreach Lead.
Hi everybody, my name is Dr. Peter Scheer. I am a recent graduate of the Accelerated MPH program. I had served as the leader for 3 of our teams, the curriculum development, program evaluation, and literature review teams, and am now serving as the program director for CIPHER and have since passed off those teams to other student leaders. So yeah, very excited to be here and to have the chance to talk with you all today.
And we're excited to introduce Coach Dave and first year student Nina later on in the presentation. So we'll pivot now to this video that was compiled by the leads of the curriculum development team. We're representing a lot of conversations and a lot of voices in this presentation today, and the work that we've been doing over the course of, what is it like now, 8 months. So really quickly, just some highlights to hear those voices and conversations before we hear from our sponsors. And let me make sure that the computer sign is on.
Public health literacy are a team of public health graduate students and expert faculty advisors whose goal is to spread public health knowledge and how people can use that knowledge to improve their lives and their communities.
I think what I would say is, I know you're still in the beginning stages, but now, especially since you're beginning to work with CBOs, I think developing those relationships is really important.
The Heights Urban Empowerment is a community-based organization that's based in Washington Heights, that's specifically for youth that come from low-income families. And we use the outdoors as a way for them to teach them of life skills like, you know, teamwork, leadership, like skills that they can apply.
WH Senior Link was formed in response to the pandemic. And the idea was basically, we call it old techniques for a new problem. So we use phone calls and care packages and mail outs in order to reach older adults, particularly those who are not otherwise connected to services. And
it has been open for 4 years here in Washington Heights. Our core mission is to come alongside in a holistic way, an empowering way to come and come alongside our families to help them throughout the first 3 years of their children's lives, or first 1,000 days. You know, we have an approach where our families are the teachers. They're the ones that guide us. We're here.
Mutual aid being this set of principles that goes back to, in this land at least, Black and Indigenous people's ways of survival under the oppressive regimes of white supremacy and racialized capitalism. Neighbors supporting one another.
Yeah, today we're just going to be talking about school reopenings and a lot of the data that's being considered as to whether certain counties or certain regions, whether it's New York City or the rest of the country or the world, should reopen or not, and you know what it.
We at CIPHER, or Citizen.
There we go. Great, and then so a quick little introduction from our amazing faculty sponsors, Dr. Bob and Kim Hopper.
Thank you so much. I think it's fair to say that in the 31 years I've been at Mailman, one of the elements of my own career that I continue to emphasize is how much my own career was influenced by my engagement in the student movement of the 1960s. Fast forward to the year 2020 in the midst of COVID-19, and we suddenly have this amazing group of students at CIPHER who are taking it on their shoulders to figure out how a public health response on the part of students should be mounted in communities like Washington Heights that have been hugely impacted by the pandemic. This is service learning in public health updated to the 21st century. I think what you're about to hear are presentations that really make it clear that what CIPHER is doing should be at the center of much of what we do when we train folk for careers in public health that will follow much of the work that our students in CIPHER have been engaged in since the summer. Pleasure to be a part of this, and I'm looking forward to the presentation. Kim?
Thanks, Bob. There's nothing quite like an epidemic to throw public health into the spotlight, and little that compares in showing how central translation is to the public health project. Studying theory under the sign of COVID last spring was both useful. We anticipated the stark segregation of mortality rates by race, class, and location, for example, and really frustrating. Even far from the fray, the city's difficulties were obvious. On their own initiative, and guided by little more than their own quiet outrage at how badly things were going at the time, when effective public messaging was emerging as critical to epidemic control, the original CIPHER upstart gang decided to join the struggle and adopted translation as their watchword. You'll hear much more about how that went today. I simply want to take this opportunity to thank them publicly for the wholly unexpected corrective they supplied to my own understanding of how theory should be taught. Much appreciated.
Great, thank you so much. And so we're going to be telling this story in 5 parts. So without further ado.
Chapter 1, Charting a Course.
So after classes went virtual in March, students were faced with several difficulties. So there was a lack of firsthand and really direct experience implementing what we've been learning in the classroom. Networking opportunities between faculty and between students also really suffered. And then there was also a reduced amount of practicum opportunities. So as COVID cases and mortality rates hit record numbers in the city, students in Dr. Kim Hopper's Social and Economic Determinants course really saw this as an opportunity for a public health intervention. And as a result, we formed CIPHER to address the lack of access to public health knowledge available to the public. As civil unrest continued due to COVID and protests against structural racism, we really made it a point to implement and center these events and lessons learned from that within our work.
And with our founding, we really set out to try and improve New York citizens' public health literacy by increasing the accessibility and transparency of health information. Our goal was really to empower individuals and give them the tools to take agency over their own health, and to give them access to resources and the ability to identify resources to take that agency and do that work themselves. And we think our principles and objectives have aligned with that. We really have sought out a mission which is centered in the community and is informed by the community. And we want to be a place and create a space where knowledge sharing among the community and institutions of higher learning is commonplace. And we think that our commitment to these principles has created that and will continue to do so as we move forward.
Chapter 2, Building the Plane.
So towards the end of spring term last year, it became really apparent that with our guiding principles, the goals, and what we had in mind and what we wanted to accomplish, really required an organized, big student effort. And as we were all kind of in a scramble and figuring out practicums, as positions were coming off of boards and plans were being switched around, it really seemed like this would be a great fit to bring students on as practicum students, volunteers, interns, as kind of the tasks, the startup tasks and the initial launch and building of this plane that we're now calling CIPHER. It just seemed that like it would have been a perfect fit. So in order to really organize our efforts, we kind of created these 5 task group buckets. So curriculum development being kind of the forefront of our health literacy mission, community needs and assets assessment, which later tacked on outreach, social media, program evaluation, and literature review. And the idea really was to plot a course with these groups to work together in tandem and support each other, and really support the development of our online curriculum, which we're hoping to launch soon, relatively soon in the last couple of months, but to come together in all these different task group buckets to utilize the students' skill sets and specialties and also build new skills. So not only did these groups come together to support content creation, but it was also nicely arranged that it was a great way to advertise to CBOs of what we were capable of, what our services were that we could provide to them while we were building this curriculum, so we could be informed by the needs that they were seeing in their own organizations, and also being able to provide literature review, social media content, and really just setting the basis for resource sharing and a foundation there to kind of bring everything together as a group, as we're all isolated at this time. And I think it's important to note we haven't met as a full group once. Everything was done remotely. And as we were welcoming on practicum students, we thought it was really important to kind of mimic a work week. And so we created these student spaces like the Journal Club, brought in guest speakers for seminar discussions, workshops, and then having just general team meetings for updates, just as a way to keep the structure, keep the momentum, and really start building connections between students. And the blueprint was great, but it really is the students that were the building block. And we were really kind of taken aback by the interest in the get-go. The blueprint, I want to say, maybe took 2 weeks of scrambling to get together all of our ideas, put it down on paper. And then within a matter of a week, we had a scope of work written up for each task group, and 30 students were interviewed within a matter of a couple of days and onboarded, most of which use this as a practicum experience or to supplement their hours. I think that we ended at the end of the summer with 41 students in total, so we kept onboarding throughout the summer, but our students are really representative of all of the departments here at Mailman and certificate programs. And it's really their work that helps kind of build while we were flying, and everything was starting from the ground up. And so being able to have kind of a set structure, but that was loosely designed so students can come in and bring in their own experiences, skills, interests, really has been kind of the cornerstone of how we've been able to get this work started and to continue to do so. So we're gonna pass it off to Peter to go through some of the different tasks and missions that were involved in these kind of overarching task groups, starting with curriculum development.
Yeah, and so really, as we had alluded to earlier already, one of our biggest missions was to create a curriculum for the public, which would increase the accessibility of public health concepts and information to, in particular, groups that were among lower health literacy populations, and where the existing inequities had only been further exacerbated by the pandemic. And we really sought to try and build this in a way that was community informed, and try to ensure that the lessons that we were building were very interactive. They're entirely online and free, and that they were given input from the community members that they would be going out to serve. And we are nearly done with that. We're hoping to launch it soon. We've created over 8 of the lessons that we initially set out to do. And we're really excited about this work and think it can be really beneficial. So along with that, though, we needed a lot of support. And so that leads us to the literature review team, which was designed in order to help support all of the resource needs that our different groups required. So that included the curriculum development. Obviously, we needed a lot of resources and tools to be able to try and design this curriculum, and also have a background understanding of how to design a curriculum like this with this target population in mind. And so the literature review team really helped to support the curriculum, but it also helped to support our social media team by designing or by giving resources for our outreach, and also the outreach that we did with our community needs and assets assessment team, which you'll hear more about later. And finally, the literature review team sought to push forward the academic literature as well by conducting literature reviews on adults' education, public health messaging, and even the mental health impact of previous pandemics on adolescents, and what we could learn from that, and how we can take those lessons and apply them to the current one, and how we can move things forward. And then with this, we also needed to have a mechanism for trying to evaluate the impact of our program. And so we had the program evaluation team, which served as that mechanism and tries to evaluate the different programs that we've been doing and the projects that we've been doing since our founding. And one of the biggest was to design an evaluation of the curriculum that we are creating. And so we designed a survey, a pre and post test survey, which will be used to analyze the effectiveness of this curriculum and the educational resources that we're sharing. And that has also been informed by the community, and community members have helped even shape the questions that were put into that, that survey. And we have now submitted that for IRB approval, and are hoping to get that back soon. Also, some of you may have participated in the faculty survey that we sent out earlier in the summer, which was designed to try and figure out where the connection points were with the different community-based organizations in and around New York City, and even outside of New York City, so that we could try and facilitate further partnership with Mailman and the community. And so with that, I'll turn it over to Asia to speak about those relationships with the community.
Thanks, Peter. So essentially, the goal of the community needs assessment and outreach team is to ensure that the community is being centered within the program as a whole. And so some ways we do this, of course, primarily through outreach, preliminary work on a Washington Heights-based needs and assets assessment, and also through a very unique partnership we formed with the mentor study, which we'll highlight more in a little bit. So some of our accomplishments is we connected a student to Coach Dave in the Word Up bookstore to implement a community fridge in the area. We later connected the fridge to a local farm source, and we also have a subgroup dedicated to supporting the fridge that Lena is a part of. We also communicate public health through brochures and fact sheets, and we also help to facilitate in the summer a meet and greet amongst all of our community partners, hosted by Coach Dave, and we're currently in the works to put on another one of these soon.
And so as my colleagues have already mentioned, social media has really kind of been where all this work is pulled, and how it's presented to our target audiences and just mailmen, our students at large. So social media has been really great because we pull from literature review. We post based on what we're hearing from community members, what they're interested in learning about, but really what CBOs are working on too, so we can plug them with our kind of more condensed, accessible public health messaging. So, I mean, below on the screen, there's some examples of some posts that you would maybe see on our Instagram. If you swipe through, kind of takes folks through an easy steps, different public health concepts or bringing awareness to certain issues and approaches. So, I mean, the social media team really is about disseminating public health information, bringing people to our website and also curating our website, where we're going to be hosting all of our curriculum and lessons. But also it's been a good point of just another level of collaborating and connecting with community partners. So not only sharing their efforts and bringing visibility to their work and events, but really just another pathway of communication and understanding each other's goals and needs just visually through virtual online platforms. We've been pretty great at getting reach with a lot of our posts. So while we only have 380 so followers and growing, a lot of these images down here can reach upwards of 600 people every time we post. So that's been really great to see. And that's also thanks to the support of other Mailman students in our effort in sharing out our content. And then we've really in the last couple of months been working with Project Stay, the project with Alan Kohal regarding sexual health services to youth. And so we've been creating a lot of content as those clinical services are now moving on into the online space and reaching populations with that information for testing and service and so forth. So that's just some of the achievements that social media has been working on most recently.
Chapter 3, Flying the Plane.
So we have all these working parts, and as things startup tasks started really coming to fruition, it really became clear that we've also built student community in our efforts. The journal clubs and the seminars really became key spaces for students to come together and really kind of debrief and analyze and synthesize all the feelings we were having as public health officials and students working through everything in terms of the pandemic, social injustice, even the election, pending election. So it really became a place where we could come together academically, but also as a support group for each other and to kind of help bolster the skills that we were learning in the classroom and then putting them in practice and having conversations about it. Aside from work, we also had some social gatherings, which were nice and just grounding. And I know for myself, I was back home for the majority of the summer, and it was nice to be able to log on and talk to like-minded public health people. So we definitely got our Zoom boot camp in before this fall term. And then another great thing is just building spaces to collaborate and organize with other student groups. And so Tej is going to talk a little bit about one of our very first partners, Mentor, but we've also been able to coordinate and have conversations with CSSC as well.
Like I said, we talk more about our very unique relationship with the mentor study. And so this is a quote from them. Mentor investigates the narratives, barriers, and unmet needs of Northern Manhattan residents during COVID. And so George and Elizabeth from Mentor attended all of our summer meetings and continue to do so in the fall. And so a little bit about this partnership. While the CBOs they worked with waited for the results of their study in the long term, we were very transparent with one another about our partnerships. And so while CBOs waited for the long-term results of the study, CIPHER was able to collaborate with these CBOs on different projects in the short term.
And kind of extending the conversation about building student communities. Lena is with us today and she'll speak live to this, but this is just a little clip of Lena, first year student, talking to other incoming students as she worked with us towards the end of the summer and talking about her experience as just coming fresh to Mailman and being able to use the CIPHER network for community support and understanding kind of the student experience coming in.
The last thing I would say is that honestly, just being a part of CNA, I feel like I've made so many friends at Mailman already. It's been really, really cool. And I feel like I've gotten a lot of like guidance from the other members of CNA because most of the members are second years and older. So just like honestly, the friendships and relationships have been really, really valuable to me. And I felt like I have found kind of like a place in Mailman where I myself feel like I have like a community and like friends and people who have like been through what I've been through in terms of, or what I'm going to go through in terms of the core and academics and just getting adjusted at Mailman. Even though our experience is going to be online, it's still been really nice to like get to know a lot of people who have been through it and know the experience and can really give like guidance and support. The last thing I would say is that honestly, just being a part of CNA, I feel like I've made so many friends at Mailman already. It's been really, really cool. And I feel like I've gotten...
So I'm happy to introduce Lena. She's also been serving as our social media co-lead. Yeah, Lena, feel free to take the floor.
Thank you so much, Kaylee. So hi, everyone. I'm Lena. I'm a first year at Mailman, as you know, in the epidemiology department. So just a little bit more about incoming student involvement. We've been working on, like I mentioned, building ties with incoming students at Mailman. So although our first semester at Columbia is rather busy with the core and everything, it's been really valuable to be involved in projects that are rooted in community health, especially to understand as early as possible the importance of community-based work, because that's something that can inform the rest of our careers in public health. And it's also been valuable for myself and for all incoming students to make ties with faculty as well as with Washington Heights CBOs, especially because many of us will be living in the area, if not now, hopefully sometime soon in the future. I've also enjoyed, for myself and for bringing in other incoming students, kind of having a real world education very early on outside of the classroom, so that we can apply our public health knowledge as soon as we learn it, especially because COVID is such a drastic situation at this time. It's nice to be able to contribute in any way that we can as soon as we learn the possible ways through academia. And lastly, I wanted to add that it's been valuable for me to learn and also help teach other incoming students about Columbia's history with surrounding communities in a realistic way, so that we can all work towards creating new and constructive relationships that are rooted in uplifting communities, again, as early as possible in our public health careers, because this can be a valuable skill in almost any future institution and in any way as we continue in the field of public health. So it's very nice to meet you all and to be here.
So now I'm going to introduce Washington Heights' own Coach Dave Crenshaw of Team Dreamers to talk about CIPHER's impact on the community and his relationship with CIPHER.
First, I'd like to say thank you all for having me. Everyone knows I work with Professor Fully Love, but Ms. Hunter has been communicating with me things about CIPHER and let me know how to work with it and what they did before the pandemic hit. And it all started with Hike to Heights. And when I say Hike to Heights, I mean Mailman, because what you have to understand is my connection with Mailman through Hike to Heights is Mailman under Professor Fullilove got $40 million from the city to reopen the High Bridge after being closed for 40 years. And then instead of walking away from our neighborhood, Mailman stayed. And now my local park on 167th is getting a $15 million makeover and a bathroom replaced that hasn't been there in 30 years. So that's one reason why I love working with the students of Mailman, and I love working with Hike to Heights. I use the name the same way. If I say Hike to Heights, I also mean Mailman. But this gives me a chance to tell CIPHER thank you. To tell CIPHER thank you for taking care of my neighborhood. Because we met at Hike to Heights in the first Saturday in June, and by that time, the thief, that's what I call the COVID, the thief had wrecked my life. I lost family members. I lost high school classmates. I really didn't know what I was going to do, but I realized I couldn't hibernate. So we were still going to have Hike to Heights. It was smaller, it was different, but we were still going to have Hike to Heights. And who showed up? CIPHER showed up. CIPHER was there walking through the neighborhood with us, going to the food pantry and actually learning that there are 200 people on the line just waiting for a cart full of food. CIPHER was there walking with us into the precinct. And when the precinct first saw us, they didn't really want to let us in. Then when I said, oh, we with the giraffe, because there's a giant Hike to Heights giraffe at the top of the precinct, and all the officers relaxed, let everyone come inside, and we took a giant group picture together because they saw it was a community coming to embrace them and not protest. They saw we was coming to work with, figure out how to work with them and not be against them. So we did this Hike to Heights things, and from that, our CIPHER relationship grew, which I really needed. Because it's the first time in my life that I can remember I have no gym, I have no park, I have no teams to work with because everything is shut down, but I refuse to hibernate, but you have to have someone to work with you. That's where the CIPHER interns came in. They became my team. We started off with a program called Books and Burgers. What does that mean? We go around giving food to people on the street, but we don't do it like the others. We grill our food. We heat our food up. We cook it right there on the sidewalk, and then we put it in the cart and we roll around the neighborhood and we make sure people on the street get hot meals. And at first folks thought they wasn't gonna take it. But then the CIPHER students realized there's always somebody out here hungry. There's always someone out here who needs this that can't go to a food pantry or a place like that. They don't have time or they're just dysfunctional. So the CIPHER students started embracing the little initiatives that we were doing in the neighborhood. It started off with Books and Burgers, because we gave our books to the kids, because the kids have to have something since the libraries were closed. We started off working the food lines, because there's 200 people on these lines with no place to go. So what do? Census outreach, voter registration, voter education. We went to where the people were at. Everyone thought everyone was stuck home. I says, no, people are still on these streets. I'm gonna show you how we do street outreach. And the CIPHER students jumped right in there. And one of the most special things they did that I skipped over is the schools were starting at 9 o'clock. Parents had trouble getting their kids up. So we started doing sunrise practices just to get kids up in the morning so they could be ready for class instead of late. And one young lady from CIPHER came all the way from Queens to do yoga at sunrise on 165th Street and Fort Washington. And when the nurses walked by, seeing all these children doing yoga during this hard time, it made the nurses and the doctors smile. This is what CIPHER helped out with. CIPHER came straight to the streets. No spotlight, no TV cameras. They just came to make a difference. Then we segued into street cleanups. Because as the neighborhood was shut down, everybody thought every night was Saturday night. They're having parties on every corner. The neighborhood is wrecked. It's getting dirtier and dirtier. The city doesn't know what they're doing. I'm not going to call out no names because we're trying to be polite today. But CIPHER helped me clean the corners and the tree pits. The corners were horrible. We looked like a third world country right here in Washington Heights. But thanks to my interns helping us out. And I'm really bragging when I say interns because I was the only one in the neighborhood that had graduate student interns. Other folks had teenagers, high school students, maybe some college. but I had graduate student interns in Washington Heights trying to get their second degree, and they came from all over the country. So instead of me being alone, I had a team. I had a team that knew what they was doing, and I didn't have to tell them what to do. So the street cleanups went better than ever. They understood we can't pick up every little thing because we got to get all these corners cleaned up and the tree pits cleaned up. And Professor Fulida was with us. We went through this neighborhood, and then I lost the team. I'm at the Insight. I can't find the team. We had a map. We had a route. This is where Mailman students step up. They saw a street that was not on our list. This street was filthy. This street was horrible. So they went off map, took extra time to clean it up, which is very, how could I say, inspiring, because other people are trying to get home quickly and just do a little work and say they went home. These students from CIPHER stayed until they got it done. So they got that street clean on 163rd and St. Nicholas. And to this time, it's never been as dirty as it was that time. Once they cleaned it up, now the neighborhood is making sure they don't wreck it again, because it was literally the dirtiest block on St. Nicholas Avenue. So we got the street cleanups going. We got books and burgers going. Then we added giving out masks, explaining to people why they need to wear masks, how to wear a mask, why it's important. This became the most important part of our mission, because without masks, this thief is going to keep taking people. We wanted to minimize the damage it was going to do to our community. So we're giving out the masks, we're cleaning up the streets, and we're learning how to work together as a team. The ideas they had for me, Dave, why you just don't put the mask in the bag? Put the census paper in with the mask. CIPHER students kept coming up with ways to make it more efficient, making it more effective. Instead of me just having everything mushed up in the cart, they showed me how to organize, plan, and go out there to be effective. So I'm really glad I got this chance to tell you how special CIPHER is and why you want to be a part of this group, because they're building relationships in the community. They're helping with the fridge. When the fridge opened up, CIPHER was there to introduce it to the community and let people know that CIPHER, Word Up Bookstore, the fridge, and the Dreamers, we all in this together. A lot of people don't understand that with all the protests going on, all the separation, it was great to see students that didn't look like me come to my neighborhood and help me with my community. No spotlights. Some of the elected officials don't even go where we go. Well, most of them don't go, but Robert Jackson and Al Taylor will always be there, okay? I have to shout out Robert Jackson, because I'm so glad that I met CIPHER, because I can't imagine what my summer would have been like without you. I can't imagine what it would have been like to have no one to talk to on Zoom about the community problems. So each night at Zoom, they said I was teaching them. They said I was explaining to them. But the truth of the matter is, when you're in this community and you care, it gets frustrating. It gets lonely. You understand? So it was my therapy as much as I was trying to learn from them, to talk to other folks trying to make a difference. No credit. They wasn't getting no money for it, anything else. We just kept brainstorming. How can we do this? How can we make things better? And then here comes Dr. Peter. Dr. Peter comes to one of the workshops and he brings me these fantastic masks, these designer masks. So instead of just giving out K95s and giving out disposable masks, we have these designer masks made by a doctor from the CIPHER program, and we give them to whoever volunteers at the different workshops. We let the volunteers pick which one, because they came in so many different designs. Oh, one lady was like, I need two, because I go to church twice a week. So I need two of your masks. I'm going to do one for Tuesday, and I'm going to use one for Sunday. Those masks were a big hit. Then we had Matthew. One day we was left with this young man. His mother left him with us as we doing a street cleanup. He got ADHD plus. And Matthew wanted to help with the t-shirts and help with the food. I said, you just take care of this young boy. But young boy went home and he said, Ma, I got a new best friend. Yeah, I got a new best friend. He's with the Dreamers. He's from that big school over there on Fort Washington by our house. He said he took care of me today and taught me how to do this and do that. And it really was tremendous help, because without that one-to-one from someone who cared, this kid will, I have to take care of this child instead of doing voter education, instead of doing census outreach. There were so many different projects that the reason why I got to give CIPHER credit is because you grew up during the pandemic. You grew up when there was a storm here and other people were just trying to stay home and play it safe. You understand? CIPHER grew up when the community was lost. We didn't know which way we was going to do. And every different project we had, even the protests, we went all the way down to Harlem and we marched all the way up to Inwood Park when they found a person of color hung from a tree. CIPHER was there. And that's going to separate you from all the other groups, because I got a big mouth. And I'm going to let people know in the summer of 2020, which is going to be a historical decade, CIPHER earned their bones. CIPHER earned their credits. They was there for whatever we needed them to do. And most importantly, you helped Coach Dave become Community Coach Dave. You helped Coach Dave never be alone. It wasn't always the whole group, but there was always somebody from CIPHER at my back, somebody from Mailman helping me out and knowing what to do without me telling them. So I really do appreciate you. We need you to stay around. We need more folks to join you, because your energy and your intelligence separates you from the average volunteers, because you can see a problem and you can make it better without all of us having to tell you what to do. So CIPHER, once again, I thank you for helping us fight this thief and minimize the impact it has on Washington Heights. I'm done, Tasia.
Thanks, Rashid.
Okay, so chapter 4, hitting turbulence.
So as we set out to form partnerships with the community, we were met with some difficulty because of the history of abuse by our institution towards the community. And as we know, this results in mistrust. And so this harms the community because we know mistrust is a barrier in communicating public health, but this also harms students that essentially are tasked with paying for the institution's wrongdoings. So an example that we ran into is when planning on how to implement the community fridge, members of the community did not want Mailman's name on that fridge. And then because when we were forming relationships with the community, we were just representing, we're a group of students, we weren't representing our institution. That served as an advantage with forming trust with the community members.
Yeah, and that kind of brings up a good point in talking about another point of turbulence to kind of rock the boat a little bit when we were getting things started over the summer. Is we were a group of students, and we still are, and we're not an official Mailman organization, student organization. And we don't really have a clear home base. And so I think, while, as Tasia said, it was an advantage to come to community members just as students that went to Mailman. There's definitely some limitations in not having a home base. And I mean, that includes some funding opportunities, being able to fundraise on our own, kind of like dancing this line between, are we going to be nonprofit-y? Are we going to be more embedded within the Columbia framework or structure? So while we were able to secure some small funds awarded by the dean, it really, our main concern was just the longevity of the project, and realizing that we are a 2-year program. Most of us are second-year students that are going to be leaving in April. And if we're not here to continue the work, and we don't have a set home base or mechanism to house us, how will this work continue forward? And I think we've demonstrated that we've got a lot done over the summer, and that was all completely free labor, and a lot of the expenses before the funds were allocated to us were entirely out of pocket of students. And it's just kind of amazing to think what we could do with substantial adequate funding and support for paid student positions moving forward.
Yeah, and one of the other things that we really struggled with was putting our ideas into practice, and realizing that, you know, as we said, much of the structure of our organization was built in a very short period of time, and we had to learn how to put our ideas into practice in a very quick time frame, in a short time frame, and you know, that meant going through a lot of hiccups. It meant learning how to navigate doing all of this work remotely, and having to try and coordinate a whole group of students and projects to work together remotely, and to not try and each be sort of siloed off in our individual work groups that we talked about earlier. It meant learning a lot of new skills and tapping in on talents that we didn't know that we had. And, you know, for me, I can just talk about the fact that like I had to learn how to, you know, create a website and help make the website. Not that I did a great job of that. We had many other talented students that helped with that, but I, you know, had to take on part of that role. And that was something I had never done before. And I had no experience in doing, but it was necessary and it was part of what needed to be done. And so we just did it. And I think that was one of the things that makes CIPHER so great, is that it gave us opportunities to put into action the real world sort of, and give us real world experience in the things that we had been learning about in our classes and at Mailman, and how to apply the things that we've been learning at Mailman.
So the unrest from the summer continued into the fall in new ways, such as Zoom fatigue, rising COVID cases, continued injustice, and a historic election. But despite all of this, we were able to incorporate CIPHER into coursework and student theses. We expanded our community partnerships, and we also welcomed and onboarded new students.
Chapter 5, Arriving at Our Destination.
Really, I think without knowing it, I mean, our plotted course really was always to cross Broadway, and this is a phrase that we take from Coach Dave. And it's just, I think, our emphasis and where we are at now, and just community first has really kind of helped us not only achieve some of our goals and making some public health information accessible, broadcasting those messages, but I think really just creating opportunities for students to cross Broadway, to show up for the surrounding community, and also just use the tools that we're getting through this degree and put them to real world application use, while getting support from other CBOs and staff and administrators along the way. So I think it's been a really great experience, and an important thing to keep moving forward, to get students, you know, out from behind Mailman's walls and out onto the streets. And all the examples Coach Dave provided, I think, were excellent uses of that. And I think another really big thing that we're reflecting for this presentation was some of the tangible, direct impacts to communities' health. So I think a really great example that Peter is going to go into a little bit is the Project Stay. We mentioned this prior in social media, but kind of turning these efforts and actually being able to see numbers and people accessing care for their health.
Yeah, so our work with Project Stay, and I think I saw Dr. Kohal on the call, so it's great to have him here. But we have been working with Project Stay, which was founded by Dr. Kohal and Renee Kohal, which provides sexual and reproductive health services to predominantly LGBT youth, and including providing HIV, STI testing, and PEP and PrEP and birth control. And one of the ways that CIPHER has been able to partner with Project Stay is to help them in creating social marketing campaigns to increase the awareness of their services and get individuals connected to services and testing. And in some cases, that hasn't been directly to testing or PEP or PrEP or birth control with Project Stay, but with other organizations. We've had individuals reach out from out of state that have gotten connected to other services out of state because they DM'd us on Instagram or sent a message based on you know, a post that we had created, and have been able to get connected to services. And you know, this is really putting into practice the work that we're trying to do, you know, which is to make public health information accessible and give individuals the tools to improve their own health. And so that leads us into, where do we go from here? What's next? What is CIPHER going to do moving forward? We have a number of projects that we're really excited about and interested in continuing to work on. One of them is a mental health friendship bench project that we're hoping to do in partnership with Senator Robert Jackson's office. We also are going to continue to work on our curriculum and translation of our materials. We're hoping to again offer opportunities for practicums this coming summer. And finally, we're hoping to fund our projects and give students the opportunity to be paid for this work and not have to choose between this and another opportunity. And on that front, we just were awarded a National Library of Medicine outreach grant in conjunction with Project Stay, and we're going to be working together on a project called Staying Healthy and Informed, Decoding HIV/AIDS Information and Resources for LGBTQ+ Youth Experiencing Homelessness in New York City. So that's a really exciting thing, and I think CIPHER, as I had alluded to at the beginning with our mission, we really aim to decode public health concepts through community-informed messaging and to try and support these community organizations that we've been talking about our work with. Our work is seeking to help lay audience unlock their full health potential by making this knowledge and these resources free and accessible. And we believe that we can utilize these evidence-based methods to make learning more equitable and accessible to those who are excluded by the traditional methods. And through this year, we have seen so many challenges that are being faced every day in our community. And we believe that CIPHER can be a part of the collective recovery of our communities surrounding Mailman. And we hope that CIPHER can work together along with the communities and the community organizations to learn from the community and strengthen their many assets, and also identify and create solutions for the needs that they have and work together to do that. And so with that, we'd like to invite you to look here at some of the ways that you can help us.
Yeah, so just because we want to be able to get to questions, we'll leave this slide up when we're fielding questions, but I think there's multiple entry points for people to get involved, whether that be faculty, students, incoming students. And I think once we have more capacity too, it would be great to broaden this to other universities and institutions where students are learning public health. I really did want to make sure that we had this slide up, one, because I think it's powerful to see all these names listed, and just a tremendous shout out to everyone that's had hands on this project and have been advisors along the way. I think every person here has just contributed so much on the slide. And again, a very special thank you to Coach Dave for really being kind of the founding connection to getting a lot of this work off the ground and bringing people to the table. So I know we only have 20-ish minutes and 10 for students that are likely going to hop off for class at the 50 mark. But yeah, we'd love to open this for questions. We have our other leadership with us here today, Paula, Priyanka, Emily, who's been doing the wonderful voiceovers, and Jamie are here. Alex as well. I'm trying to go through all of the names that are happy to answer questions, and we can leave all of our information too as a follow-up for further questions. But yes, we'd love to open that up.
So if I may, first I want to praise you for a tremendous presentation and wonderful work. That's number one. Number two, more importantly, I firmly believe that you can write this up as a journal article for SOPHE, the Society for Public Health Education's practice journal, and that's called Health Promotion and Practice. I'm going to call on my colleague who's on right now, Dr. Rachel Shelton, who is on the editorial board for SOPHE's scientific journal, and that's Health Education and Practice. I am sure Rachel could make a direct introduction to you, to your leadership, to folks on the editorial board of Health Promotion and Practice. This is an ideal example of what that journal is trying to publish. So congratulations. And Rachel, thoughts on that?
Yes, I just wrote in the box. I'm happy to do that. I can make that connection. Jesus Ramirez is currently the editor, and he actually has a special issue right now in Health Education and Behavior where they're soliciting and timely articles on things that have happened in the context of COVID. So I think this could be a great example. So just reach out to me and I can help make that connection.
Absolutely, we'll do that.
Hi. One of the things about a student-based organization is that the students are here for a couple of years and then they move on. So how do you envision the lifeline as new students come into the program and students graduate from the program?
Yeah, so I think there's a variety of ways that we're looking at trying to maintain the longevity of the project. One of them is, even though I have graduated and no longer at Mailman, I'm continuing to stay on as the program director for at least the next year to help try and oversee those transitions and help maintain some consistency within the organization and provide some structure and leadership and guidance as we do experience some transition. I think the other thing too that will be important is to continue to have the support of faculty advisors that will help us with those transitions and to bring on new students and continue to build out the sort of structure that we have in place and be able to put people into some of the roles that we've designed and created, and we already have sort of workflows for. And so I think that just like any other position or job, there's opportunity to train students and give them the chance to take on that new role. And it's just about having some of the leadership there to ensure that longevity is there as well. And I'm a part of trying to ensure that happens. And any of the other leadership, you guys are welcome to talk about that too.
Yeah, I think it's been a question that's definitely been in the forefront of our mind. And I think we've all been kind of blown away at just how different this fall term has been from past, and to keep things going and moving forward and expanding possibilities. And I definitely think it needs to continue, especially since we have all these community ties, and we're open to more conversations of just how folks maybe would see that continuing forward. But definitely I can see this bringing in students too. So any way that whether it takes the path of an embedded center, or if it does kind of become a nonprofit that's started up by some of the students that are with us now to kind of keep the connection going, we're definitely open to those conversations. Any other questions?
Really, I have several thoughts and questions, but I talk to you occasionally about this, so I want to be sure others have a chance.
Kaylee, this is Angela. I have a quick question, and that is that have you reached out to other students in nursing or other kind of programs? Particularly, there are kind of tracks or specialties within many nursing, nutrition that are really public health or community health focused.
Yes, I mean, that's been on the docket for a while, and I think it was really tough planning for the fall because we really didn't know what our capacity would be, since we're all wearing a bajillion different hats. But that's definitely, I think, and we've talked about this with Dr. Sycamore before, but there's just so many ways that this could expand, and I think it could definitely kind of take on a full kind of more Columbia widespread approach. I mean, it would be great to tap into some of the art departments, the video departments to help facilitate this work and take the load off of just public health students, but also, I mean, being informed by, other budding practitioners and professionals. So I think there's a lot of ways to go with it. It's just, we need to, be rooted and make sure that, we're not going over capacity, because we definitely hit the ground running, and there were definitely points where we took on a little too much, more than we could chew, but it's definitely in the
and I will say just on that front too, is that we have had, some involvement from other students, but it just hasn't been as like consistent, and even some volunteers from the community as well that have helped with things, and have worked on different projects with us as well. So that's definitely something that we want to continue to do. And part of our partnership with Project Stay has really facilitated that through a number of their health educators, which includes the post-bac students from the main campus, and working with them in particular on some of the outreach campaigns that we've worked on with Project Stay for some of their work, and kind of partnered with them. So.
If I could just ask a practical question in some ways, as I watch the chat coming, like that, thanks Rachel for the idea of engaging with the community core and the CTSA. There may be other infrastructures that have, I guess my practical question is to all of you, what's our best next step for brainstorming where to go from here? Because for example, I know all about the friendship bench. I'm a clinical psychologist. I'd love to be involved in the friendship bench idea, right? But how should we collect an amount of energy that I think you certainly have created by today's presentation, as was noted by several faculty, that it's just, it's so incredibly impressive. And I think I can say proud. We're so proud of you that Marita's praising you. I think it's just remarkable. I know Bob and Kim have been telling us this, but it's so great to see this. And I'm thinking, how do we send this tape to communications? And how do we turn this into something so people can really understand better what you do? But as you say, Kaylee, we don't want to overwhelm you either. And I do want to say, I am really glad that you found social support and community in this, given the remote world that you've endured, as we've all endured for the last several months. So that's sort of a combination of my comments about just letting you know how incredibly impressed and proud we are of your efforts, and how essential it is that we figure out how they continue. And it's great, Peter, that with working with Al Cole Hall, you've received your first formal outside funding, and sort of what model should we think about for maintaining. So I think, I guess my specific question is, and we can certainly talk about this more later, but what should be our next step for gathering energy and interest and thoughts about how to move this forward without all of the burden falling on a subset of you that have basically made this one of your most major commitments, I imagine, within the past 9 months. So.
Yeah, I think, oh, sorry, go ahead, Kaylee.
Oh, I just because we have our other leadership here, I wanted to make sure they had a chance to jump on that question.
Sure, I can speak to, at least you brought up the mental health bench, and one way in which we've really done a lot of our work is by creating a bigger network, and that's through engaging all our CBOs, connecting them with each other, and working with other student groups so that we can share resources. And that's kind of how our community fridge, for example, came about. So with the mental health bench, obviously, we don't necessarily have all the resources to fund or equip that. But what we're trying to do is find other members, whether that's through engaging with the medical school or the nursing school, to get resources, to get faculty and students involved as volunteers and advisors, to help us set up that program and help Senator Jackson's office fund initiatives like that. So being able to maybe establish ourselves amongst the Mailman and broader Columbia community to get those resources flowing and create those networks would be a great way one way to move forward.
Yeah, I think mapping out, and please, Tasia.
Oh, yeah. I think also we're in the midst of planning our second CBO meet and greet, and when that's all planned, all of your attendance would be welcome there. And that's a place where you can hear directly from community members and CBOs what they need.
Yeah, I think next steps are just, I think, mapping out who's interested where, and really help with the planning, because that's kind of been the heaviest lift, and it's been definitely the hardest this fall. And I know, I think we're anticipating really going into talking really more in depth and doing some more planning over the break too in December. So I think even if just having a list of where we know people are interested in pitching in and where those connections are would help. And then where this is all completely new to us, and so any advice or guidance in terms of just taking over an organization through transitionary periods, or what it really takes, the nuts and bolts to get something like this official and finalized. But
yeah, just to quickly add to that, also just to plug the faculty survey again, that's something we're hoping to send out in maybe 2 weeks, another version of it. And we'd be happy to add a section on how, or, catch any interest that faculty have in working with us or any of the CBOs are working with. But it's great because so far, even though we only have, I think we got 20 faculty responses, but with that itself, we got around 70 connections with CBOs. So it'd be amazing to grow that network.
And I think one last point too is just, I think something we learned through the journal club really was just, as an institution and department, just bringing in more voices that we traditionally don't hear in academic settings. So I mean, some of our best journal clubs were with Chris Nickel from Senator Robert Jackson's office, talking about community resilience and going to the source. And we've had just kind of a good mix of faculty, community members, and just different scholars of totally different fields, and bringing in new ideas that maybe aren't adapted or readily, I wouldn't say readily amenable, but just, I don't know, readily sought in public health, just trend-wise. But so that's been a really great way, just bringing in kind of radical, unique voices, and not being afraid to bring in folks to those spaces.
Another mechanism that I would recommend for disseminating these various programs is through our alumni network here at the medical center. You don't have to go farther than that. We have alumni, and if you ask the faculty, we can tell you we have alumni in the School of Nursing, in the School of Medicine, all throughout different departments who stayed here when they graduated and are working, and kind of a call to arms of all of those folks. I think they could easily get re-involved with Mailman as alumni through these programs.
I think in addition, going off of that, connecting with faculty in hopes that they'll connect us with alumni. Shouts out to Marita, who did just that. She connected us with Alexis and Louisa that worked on the NYP Needs and Assets Assessment.
Yeah, and I think the other thing too, and just as another plug for this, one of the really great ways that I think has supplemented the work that we've been doing throughout the fall is the integration into coursework. I think just in my experience, coming from medical school in a very practical setting, and then coming into Mailman and into classwork that sometimes was very hypothetical or very sort of theory based, and not as practical or not as directly applicable. It was really important for me and really helpful for me with CIPHER to put into practice the things that we're learning in the real world and apply them to real world experiences, and not just have a sort of scenario. Imagine you are X person, and what would your intervention be? But let's give us a real world scenario and say, we have Coach Dave and the Dreamers, and they have this need. What's the intervention that we can design to try and help meet that need in the community? And really making that connection, because those connections exist, and those partnerships are there, and the needs are there. and we have the student power and the resources to be able to put that learning into practice right in the classroom with those community organizations and with the community members. And I think that will really transform the way that education happens at Mailman. And that's really one of my, big sort of encouragements to all of the faculty that are on this call as well, because I think that is one of the ways that we can truly transform our education to something that is, giving us real tangible skills that will be used to improve the lives of the community members, that we're trying to serve. And it's beneficial for the students, obviously, as well, because they're still learning. You're learning how to do that, but you're putting it into practice. You're putting it into a real world experience, a real world situation.
And I will say we've piloted that a little bit this fall with Dr. Bob's evaluation of health programs class. So having CBOs record themselves talking about their programs, and then students throughout the course of the term develop an evaluation plan that can be presented back as an option. And also our health literacy course. I mean, I think even just simple as we had to make, how-to guides that were digestible and at a 4th grade reading level on a variety of different health topics, and then later a brochure about some health promotion effort. And I think even just like being able to take those assignments to use to create content later, or just having the options for students to pick from a variety of topics or CBOs that those deliverables could go directly to, or even, rounding up those coursework submissions and just being able to use that as source material is a really simple way, I think, of incorporating it without totally redesign or, yeah.
Thanks, Kaylee. I know I'm just going to jump in here to say, would you mind just do you have control of the PowerPoint, or do I? It'd be nice to see all of, go ahead, can you, I just want to see more of you in one shot as we wrap up.
Yeah.
Makes me feel a little bit more like we're in a room, even though I know we're not. So I just want to say, I know many of you are jumping off in 2 minutes, and we certainly are trying, but not doing so well at giving breaks between Zooms. And so I'm going to try to be sure to let you do that. Just again to say thank you so incredibly much. It's so meaningful and innovative. And we all will think about how to be a part of this, as well as think about how to find support for it, and think about what is being developed at the school level that it can be integrated in, and so on. So one of the topics that we've been thinking about at the administrative level is how to build back better, which other people have used that logo, but it's one that we're using. This fits very nicely into that thinking. And so I just want to say that we're committed to supporting you in this and trying to figure out how we go forward, and be sure people know what you're doing, and figure out how it can continue. So I'm not sure if Bob or Kim want to say any other great thanks, but hopefully I've captured what amazing work from the CIPHER team, is what the last chat says. So I think we could conclude with that and give our most sincere thanks and appreciation for what you're doing for our community, and in helping to make our relationship with our community much stronger and better, and hopefully setting the stage for less turbulence to come in the future. And for whatever turbulence that we hit, we have the plane that you're building to guide us. So thank you really very much. All right. Excellent. Really, you should feel so proud. So thanks everyone, sincerely.
Thanks, and thanks for giving us this space.
Thank you everybody for coming.
Yes, thrilled.
Thank you, everyone.